Here's what I want you to know about charting in Epic. So I have a patient open, but let's start back at the very beginning. So I am in Playground. You can create a patient list. We'll work through that. But once you have a patient list, to be able to print your papers, you may not be able to see it because this sometimes it comes up. So I've got a patient selected, and one of the options here in Live is to print a report sheet. So I don't have that option here, but once I picked it, I would just click in the box where that information has come, and I'll right click and print. And I'll have to do that for each of my papers, each of my patients. So I've got all my papers printed, and that's going to give me my report sheets. Most of your documentation happens in flow sheets. So here I am in flow sheets. What I don't want you documenting too are anything that creates a score. So none of the scoring parts like the Braden risk or the fall score, the sepsis score. The other things would be like the tele-discontinuation that shows up twice a day. None of those are appropriate for students, so make sure you're not documenting to those. What I do expect is a full head to toe. So that means that we're capturing pretty much every section other than that, and I do want to talk about these body systems that have the WDL statements. So every WDL statement has row information here on the right, as long as you haven't clicked an arrow. So if this happens and you have no row information, look at the bottom for an arrow. It may have unclicked itself. So here's my definition. So if I am WDL except that this person has been battered up and has a bloody nose, I'm going to do WDL except nose. Let's see, they got their eye too. And so then I'm going to do, let's see, left eye is not a problem, but right eye has some drainage and stuff. And then bilateral nostrils are congested, tender, with bloody drainage. So if you're doing an except for anything, you have to put what. So you can't just say except nose. You have to then document to those. That's how modified charting by exception works. So you're going to continue to do that for all of your WDL statements, making sure you're capturing all of these. The only time I do chart normals is I document breath sounds. So I may even do WDL and then still open up breath sounds. I can't seem to get out of the habit of documenting breath sounds. I think it's super important. So you're going to go through and document all of those, again, leaving out anything that scores because we have so many interventions that I'd really rather the RN be the one that is doing those. Something else that you should keep in mind on is intake and output, making sure we're keeping up with intake and output and we're documenting as we go, especially if you're in a higher level of care like progressive care or critical care. If you try to document something here, it's not going to work. What you have to do is click on this hamburger menu and open that up, and then click on Add PO, and then under the Add PO, you can add your volume. Same thing happens for urine. I'm going to have to click on the hamburger menu, pick void or Foley, or if you had a patient that voided a little bit and then had a Foley, or had a Foley and then voided, you can pick both, and just make sure that you're putting the right urine amounts into the right sections. So we emptied their Foley for 500, they peed 50, then that's how you would document. Bladder scanning is an intake and output now, just so you know where it is. Unmeasurable is things that you didn't measure, so if they got up and peed once and they didn't have a hat, then that's where you would put in urine occurrence 1, and then it'll ask you for amount. Same thing with like emesis or things like that. For medications, there's a couple tips that might make your life easier. One, meds due. So if you have a med pass, you're working on your morning med pass, meds due will pull together all the meds that are due. It will not pull together any overdue meds. If you do have overdue meds, you will have an overdue meds section. So make sure you check on that if you see it. Other things to keep in mind, if you click here in this white, it opens up more information. In live, you have MedPass in a minute. We are asking that any new medications indicated by these yellow you would do a sheet, a MedPass in a minute sheet for the patient in their preferred language. So for any meds that are new for that patient. And then Micromedics is also here. So here's Micromedics, and this is going to tell me about my IV compatibility, or if you want more information than you're getting in MedPass. So the IV compatibility is here for Micromedics if you're trying to figure out if your primary and your secondary are compatible. If in doubt, they're not. If you have this, if we're missing a med, this RX button will give you a med. If you have an exclamation point in red, that means pharmacy hasn't checked the med yet, so it's not going to be here and you're not going to be able to pull it from the Omnicell yet. This tells you where that med is from, so this means pharmacy is going to send it up. If it has the ADS, so if it says like 4 West A ADS, then that means it's coming from the Omnicell. I'm not going to have you writing notes because they're really hard to co-sign and get out of someone's chart if they're wrong or whatever. So we're not going to be writing notes, but you can certainly view other people's notes and you can sort them. If you just want the H&P, that's a super way to sort out the H&P or the consult notes by using those tabs. Brain is super helpful. It's something that we're really wanting nurses to get used to using because it has tasks. You'll see these were labs that were obtained. See how they're checked off. You can add a task that only shows up for you. So if you need to remember to do something or go back, you can add a task and put it somewhere. These are meds. This tells you you have 3 meds, and if you click on it, it'll tell you all of them. Even if a med was held by a provider, they will show up. It'll just say held when you click on it, but it is annoying to have meds that you aren't supposed to give that are still showing up in your to-do list. This is showing labs that were not obtained, and then this shows a patient tentative schedule of when they're off the floor for a procedure or a test. If your patient goes home and you need to complete documentation, you can go to Patient Station and go to Recent Patients, and any patient that you'd opened recently is going to show up here in Patient Station to reopen. So this is how you would open them back up. You're just going to find their admission and reopen their chart that way, and then you can complete your documentation.